be it a budgetary or a legislative issue, council is fully prepared to support those initiatives. Clearly, we don't want a panic, but we are asking people to be cautious and follow the science. So I want to thank the mayor and his team so much for you all being on top of this and being proactive in terms of the eventuality that this reaches the city of Philadelphia. So thank you very much.
Thank you, sir. The first presumptive confirmed case in Philadelphia raises a host of questions about how we go about our daily lives in Philadelphia. As you heard from Dr. Farley, we are now advising that Philadelphians consider not attending public gatherings with more than 5,000 expected attendees. Obviously, this is a difficult situation, and we certainly recognize that many businesses and individuals rely on these sorts of events for their livelihood. Today, in light of this development, I specifically reached out to the organizers of the St. Patrick's Day Parade and recommended that they urge supporters to stay home and watch on television. We make this recommendation with a heavy heart because we know how beloved that parade is for so many Philadelphians, recognize its 250th anniversary this year, and certainly recognize the hard work that all of its volunteers have put into it. But we also do so with an abundance of caution. This also impacts our sports teams, both professional, collegiate, and even high school. It is simply far more important at this point in time, and to keep our residents and visitors out of large crowds of that size. Again, this is an evolving situation. The health department is evaluating the need for precautions constantly, and the city will continue to provide guidance based on the evaluation of Dr. Farley, our emergency management, and the entire city team. It's happy to open the floor for questions at this point.
In interest of the confidentiality of the patient, really no more details than what I said before. This was an adult from the city of Philadelphia that was exposed to a known case. The person is being treated at home.
Was this diagnosed today or earlier?
I can only tell you that we got the test result today, that the diagnosis may have been earlier. We're not recommending closing any Philadelphia schools. In general, this infection of children appear to be at low risk. I can say that this person did expose other people, and we will be coming in. We will contact those other people to make sure that they're quarantined. I can't tell you whether there are children amongst those who were exposed.
Have you already contacted the people who were in touch with the patient, or should they expect to hear from you?
We have already started that process. I don't know if we've reached them all, so it's possible that some of them have not been reached yet. I can't tell you how many, no.
So I appreciate the question. We've been planning for this for weeks, frankly. So we have plans. Again, some of this, and again, consulting with Dr. Farley, who's the best in the business. We're fortunate to have him on our team. We're ready. There's still a lot of unknown unknowns, but we have contingency plans for operating with less staff than we expect normally. We have contingency plans potentially for. We want to make sure our providers are treated. We have potential to have to quarantine providers. So those are all things that we've been working on. And every city agency, this is the continuity of operations, every city agency, regardless of what they do, has those same plans. And that's a lot of what we've been working on. We'll continue to work on. But again, you can imagine, as you think about the scope of city services, there's a lot of work that needs to continue. The daily work needs to continue regardless of this fact. And rest assured, all of that is happening. That's one reason we're activating the EOC tomorrow, because we're elevating that activity.
What power does the city have to shut down large events like the parade or convention, and what would you use to exercise that power?
Yeah, so the city does have the authority, if it wanted to cancel such events. We don't see a need to do that right now. We think that the appropriate response is simply a recommendation, which we think most people will follow, and that will reduce the crowd sizes. As far as what we might do in the future, I can't say. If this gets worse, then we may be changing those recommendations and lowering the threshold, for example, of the size of those events. And we may, I can't say whether we could in the future actually require the closure, but we're certainly not there now.
The organizers were understanding of the city's position. Clearly, they are recognize that This is an important public health situation that we found ourselves in. We didn't make this request lightly, and they've been very responsive and respectful of the city's position. They are still planning to have the parade, but understand that we prefer folks not attend in person and watch on TV.
Dr. Marley, how many days went by from the time that the Philadelphia patient started showing symptoms until he or she was quarantined? And do we know how active he was, or he or she was, in terms of groceries purchased in, in contact with numerous people?
I don't have the details. I can say that there is always a certain amount of time between when someone develops symptoms and when they get a diagnosis and a test result. We want to shorten that time as much as possible. During that time, this person did expose other people, and so we're going to be finding those people and getting them in quarantine. Well, experience from other countries says that the vast majority of the transmission occurs to people who are close household contacts. And so most of the contacts are going to be easy to find. We may not be able to find everyone, which is why we're also taking these steps to reduce community-wide spread, but we think we can find the majority of them. I can't tell you what it is. There are many more opportunities to be exposed now than there were earlier because there are cases in countries around the world. There are cases all over the United States. I'm sorry, can you repeat the question? I can't respond about any individual hospital. I can tell you that we are working with all the hospital systems in Philadelphia and have for a long time. And we have an ongoing emergency planning relationship with all the hospitals in the city, and so that they're all prepared to deal with these cases if they were to come there. This is a presumptive positive. It was a positive test here. We will send confirmatory testing to the Centers for Disease Control, but we would think it's extremely likely that this will be confirmed, and so we're acting on that assumption. You know, at the end of each day, we update the number of people under investigation. It changes all the time. So but at the end of today, you will get information about how many people we currently have under investigation. I do not have it right now. I do not recommend the closure of universities at this point, no. At the moment, we're not recommending that. We are recommending that all organizations look into that possibility should we make that recommendation in the future. But the number of people that someone is exposed to at work is a good bit smaller than at these large public gatherings. And so we're not there yet. It's just something for all organizations to think about, should we need to do that in the future.
And we are encouraging all of our private employers to relax their sick leave policies to be able to give every consideration to workers as we work through what this outbreak may or may not be.
I don't know exactly how CDC is defining community spread, but I would simply say that if we have cases with no recognized exposure, we have to assume that there are some cases that have not come to the attention of physicians. And so that triggers us to be more proactive in trying to prevent spread through actions like our recommendations on the public gatherings today. I can't say that it was not the case that was diagnosed in Philadelphia today, or that we are reporting today, but we now have some number of cases in the greater Philadelphia area. I don't have the exact number, but it's probably between 5 and 10. And I can tell you that not all of them had a known exposure. You know, I think the universities have all been very proactive and responsive already about this, and they're looking into distance learning and reducing travel among students, we are not recommending that they cancel large classes. That may happen at some point in the future. They need to plan for that, but I think the universities are very much on top of this. Yeah, so people who are sick and need clinical evaluation should go where they go for medical care under ordinary circumstances. If many of them go to an emergency room, an urgent care center, if they have a primary care physician or a clinic that they go to, they should go to those clinics. We do have sites where everyone can receive care in Philadelphia regardless of ability to pay. If they are sick with a fever but don't feel they need medical attention, they're not feeling terribly ill, then they should first stay away from other people and then contact their doctor to see about getting in a test.
So we're considering a host of options. We recognize the intense and deep poverty in the city, and that treating and managing through that population is going to be more difficult than some of our colleagues. I don't have specific answers, but it is absolutely something that we are considering and have at front of mind as we move forward.
I believe so, yes.
Council?
None at this point, but there are certain provisions within the city code that could possibly be triggered if we reach a certain level. But at this point, there's not the discussion about that in any particular way.
Great, thank you all.